Research shows 1 in 4 adults drink at least one sugary drink a day. And each 20-ounce soda contains 16 teaspoons of sugar and 240 calories. Here to talk about the health effects of all of this added sugar is Dr. Harold Goldstein, Executive Director of the California Center for Public Health Advocacy. Harold, what is the connection between sugary drinks and conditions like type 2 diabetes and obesity?
You know, Kenny, it's a direct connection. There's now overwhelming evidence showing that the consumption of all of this sugar and soda and sports drinks and energy drinks, vitamin water, that all of that sugar gets absorbed very quickly in the body, that over time it wears out the pancreas on the one side, and it turns to fat in the liver. And this combination of worn out pancreas and fatty liver leads directly to diabetes.
Now, the beverage industry says type 2 diabetes and obesity are very complex problems and that it's unfair to blame their products for these health conditions. What do you say to that?
You know, I say it's true. A lot of these problems, most problems in our society are complex, absolutely. We have a responsibility to do what we can to make a difference and to focus on the biggest culprits. The latest research shows that half of the obesity epidemic has been caused strictly by all these sugary beverages. Compared to 30 years ago, people are consuming 120 more calories per day just from these sugary beverages. That's twice as much. Portion sizes have gotten a lot bigger. They're advertised everywhere. It used to be you go to a restaurant and you'd get a 12-ounce glass, mostly with ice, right? Now you go to a fast food restaurant and you get a refillable 32-ounce cup.
Now, the beverage industry says they don't advertise their products as health foods, and all the ingredients are listed on the labels. So what's the big deal?
You know, the big deal is that most people know that drinking this stuff isn't like eating broccoli. But I don't think most people realize that when you consume all of this liquid sugar, that it is leading directly to fatty liver disease, and that kids who drink this are significantly more likely to be obese and more likely to have diabetes later in life. Right now in the United States, almost a quarter of teenagers have either diabetes or prediabetes. That's astounding. A quarter of teenagers now have diabetes or prediabetes, and 2/3 of them drink a sugary drink or more a day. That's the equivalent of sticking 16 teaspoons of sugar directly into their veins, and we now see the results, direct results of all of that sugar consumption.
Now, one way of reducing consumption, it's been suggested, is to raise taxes on sodas and other sugary drinks. Berkeley has done that, and so has the country of Mexico. What can you tell us about the results from these taxes?
You know, what we're seeing from these taxes is that they work, and they work in two different ways. They raise the price, and they therefore lower consumption some. And I think even more importantly, they raise a significant amount of money to mitigate, to start solving the problems that these products cause. Take a tax on sugary beverages and using it like they're going to be doing in Berkeley to have healthy food programs in schools or more physical activity. Physical activity, we've got to have our kids burning off all these calories that they're consuming from the sugary drinks. It makes a lot of sense to me that we tax those products and use the money. It's in some ways it's like a gasoline tax, say. Gasoline tax isn't telling people don't use gasoline. Gasoline tax is used to fix the roads, because when you use the roads, by buying gasoline and driving your car, something has to fix it, and there needs to be a funding source to fix it. Let's do the same with sugary beverages.
And what's the possibility that these taxes, lastly, could spread in California or other places in the country?
Yeah, Kenny, it's a really good question. I think we are at the very beginning of a worldwide movement where there are going to be more and more of these taxes. The beverage industry likes to say that most places aren't like Berkeley, but what we know is that Berkeley has started a lot of worldwide movements. The free speech movement started in Berkeley. I can guarantee you there are going to be a lot more places in California and across the country that are going to be doing these sugary drink taxes.
Well, Harold Goldstein, thanks for coming in.
My pleasure.